Good day. I'm Pamela Arora. I'm the president and CEO of AAMI, and I have with me here today Dr. Chris DeRienzo,
You got it.
who's the Chief Physician Executive of the American Hospital Association. Thank you for being here, Chris.
It's a pleasure.
Excellent. Chris is a pediatrician and neonatologist focused on improving healthcare delivery and fostering innovation. And his accolades are many in the awards, but we're going to keep it short today. So I just wanted to share that today, January 29th, the American Hospital Association and AAMI co-hosted a collaborative engagement on engineering medical safety by design. This is really in line with AAMI's mission because we're deeply committed to ensuring the safe use of healthcare technology and absolutely part of AHA's purview. But I wanted Chris to share a little bit around what was the inception for this summit.
Happy to do so, Pamela. And again, thank you so much for partnering us on this crucial initiative. About 2 years ago, AHA started a patient safety initiative. And through that process, which now has over 1,800 hospitals engaged, we heard a lot from our members around the work that they do to catalyze, convene, and connect with each other to improve patient safety. One thing we heard from them, though, was we can't do it all on our own. Healthcare is an ecosystem and an area where they said we need help. Is we use a lot of devices in caring for patients. I'm a neonatologist, and so we use countless devices, many of them really small, to care for our babies. And sometimes we experience safety issues with those devices that wind up being challenges from upstream. And so they said we would love to have a way to connect with the folks who design and manufacture medical devices so that we can create some more collaboration. That was the original idea. It actually also showed up in an AHRQ report last year that there was a push to try to bring our two sides of the healthcare ecosystem further together. And so when we reached out to AAMI and you all were interested in helping host this convening, we could not have been happier.
Oh, AAMI was as well. Very honored to co-host the event. And the stakeholders, it was just amazing the diversity we got to the table. We had the manufacturers, we had the hospital systems, we had folks that were focused on human factors. We had people who really had a deep understanding of the regulatory agencies as well. They really kind of, with the speakers, set the table for the solutions lab. Do you want to talk a little bit about how the speakers set the stage for the work that was done?
You bet. I mean, when you think about engineering safety by design, that's a really big topic. And so one thing that we tried to do together was say, let's find some folks who can help tee up the challenges that we face. And there are many, and they exist throughout sort of the life cycle of how a piece of equipment or software is designed, how it's then manufactured, how it gets regulated, how it gets used, and then how you get feedback loops from using it in real life to back all the way to the folks who design it. So Terry Fairbanks from MedStar led us off with just this spectacular foundational grounding in human factors engineering. And, the way that we try to solve for safety downstream is challenging and oftentimes less strong than when you can fix the design upstream. I love the example of bathroom doors on airplanes. You can't turn the light on without locking the door. And so there's a forcing function there that means if you're going to use a restroom and you want to see that that door is locked, and so that's going to prevent someone from accidentally busting in on you. So that kind of thinking, is still relatively new to our work in healthcare. So Dr. Fairbanks helped set the table. And then we had folks from the world of medical device and sterilization share their pathways. We had some really terrific human factors engineers, and we had folks with some experience in how our regulatory agencies think about medical devices and ultimately the use of them in terms of patient care. And that was really helpful framing for the solution lab that followed.
It really hit all of the different components. Everyone was learning from each other. It was delightful. There were some outcomes that came from the solution lab. I like the way it was structured. There was multidisciplinary groups in all of the breakout groups. But if you wanted to sum up what came out of the solution lab as well as the next steps, it boiled down in a good way, I thought.
Yeah.
Yeah.
I mean, as with any good solution lab, we had, post-it note products all over the walls of your AAMI headquarters here. And so apologies for the cleanup that's required there.
Yes,
But
happy
what
to do it.
what that led to, I think, is what you and I were driving for when we brought these groups together. We are blessed to connect with on the order of 5,000 hospitals and health systems across the country. And you have contacts throughout the world of industry in medical devices and sterilization. And what we uncovered today, I think, is an energy to want to collaborate with each other in new, different, and deeper ways that we both thought was probably there. And so, those solution labs and the four groups brought forward a number of ideas that our two organizations can help facilitate to try to bring new kinds of collaboration around patient safety to the world that is medical devices and design and use of those medical devices in clinical care. So I couldn't be more excited about that. We committed together to ensure that we didn't end the day with thinking about thinking how things could be different. So we've got our marching orders, and I think we've got some folks expecting us to execute on them.
Absolutely. And the other outcome was a desire to have more reports and standards that folks could rally around and engage in creating so that we can have better outcomes as well. I did find it fascinating the stories that were shared around the complexities of making sure that all of the components together, the example of the implantable, and then you have a pacemaker, and then if you're trying to do an MRI, you could be causing harm to that patient depending on how that's handled. When you look at that complexity, you really cannot solve these issues unless you're bringing all the folks to the table because it's a complex environment that you live in every day at the front lines.
Well, you get exposed to it with the membership that you have at AAMI, and I love that example because, again, we have super deep subject matter experts in hospitals, and those same kinds of subject matter experts go super deep in how you build medical devices, for example, to withstand an MRI and be safe. They have frequently no idea what each other's processes look like. And that, I mean, just part of today's conversation was being able to help folks who live in that world see, well, this is what it's actually like in a hospital, and this is what credentialing looks like, and a peer review process, and this is how we bring new devices in. And then for the folks in our world in hospitals to hear, you mean you'd go through 500,000 simulations in order to do of different sizes? I had no idea that folks did that, So I think even just that learning and the opportunity to offer connections, again, these are folks who we knew were coming together with a shared interest in safety. So I think we will have second and third order effects from today's conversations just in the relationships form that I'm really excited about.
I am too, and I'm looking forward to those next steps. There absolutely will be another convening, I'm certain, in our future.
Amen.
Excellent. Thanks so much.
It's been a
Appreciate it.
privilege.